Thank you, Senator. Dr. Blase, Dr. Pope actually hit what I wanted to somewhat close on with you. What is the scale of fraud, do you believe, in the Medicaid home visiting programs in places like, we have now binders in our office in regards to New York City. Can you walk me through your understanding of what's going on in these?
I mean, the scale is massive, Mr. Chairman. That one program grew from a $1 billion program to an $11 billion program within a few years. There are more home health aides per capita in New York than the national average, I think, by a factor of 3. The scale is massive. I mean, you're talking New York's Medicaid program is the federal, so the New York's Medicaid program is, and Chris could probably correct me on this, I think it's $110, $120 billion a year. And I think improper payments, waste, fraud, and abuse are easily a quarter of that spending.
Now, is this an example, as all 4 of you have actually sort of either touched on or come close to touching on it, states are partially incentivized to expand access to this because it's money into the state?
Yes, and every interest group in the state knows that and lobbies the state and tells the state that they can construct financing gimmicks that pass even more of the cost than it appears on paper to the federal taxpayer. There are medical industrial complexes in every state. Every state engages in financing gimmicks. The federal government allows them up to a certain degree. Fortunately, last year's reconciliation bill does include reforms to some of the financing gimmicks and some of the corporate welfare payoffs that have been made through the Medicaid program. But the Medicaid program is no longer what we think of as a social safety net program for the most vulnerable. It has become a way for states to deliver lots of payments, much of it corporate welfare, to powerful interests in those states. And the solution to that problem is for Congress to address the open-ended nature of the commitment. As long as Congress continues to allow states to spend and underwrites the vast majority of that spending without limit, states will face those same incentives. If you are a state policymaker, even a conservative in a state, and you look at your budget and you have budget challenges, you can do 3 things. You can raise taxes, you can cut spending, or you could look at a legalized money laundering tactics to get more money from the federal government. And the incentives that face state politicians are not to raise taxes, they're not to cut spending. They're to engage in legalized money laundering to get as much money as possible. So it is not surprising, it should not be surprising that we have so much waste, fraud, and abuse and improper spending in the Medicaid program. That is the incentive that faces states. And to your point, those interest groups, they lobby those states to say this is stimulus, economic stimulus for our state, because this money is all going to come, or the vast majority of it's coming from federal taxpayers.
And almost every dime of it is borrowed by us.
Correct.
I mean, look, I think, I hate to say it incorrectly, I think if you do the last 12 months, now, there was a period of no borrowing authority, but we're borrowing $90,000, $98,000 every second. And a few months ago, I did a bit of a presentation of what was happening in New York, in the Medicaid system, signing up your relatives, and I actually got some angry letters from groups that acted like they were a group of lobbyists to lobby for the fraud. Yeah. And you start to realize, so often we use the language of, waste, fraud, and then we've now started to add the language and misalignment, where we're the idiots that wrote the language that created a way to cheat it, shall we say. Both senators actually told me be prepared. You're going to get a number of written questions because as we're trying to build a portfolio here, it is intensely frustrating because so often the political class cares more about, can I talk about a fraud in a tweet in a way where it's a couple lines and I have a straw man to beat the crap out of, and not talk about our failure to design programs that the incentives align, and that alignment stops the leakage, whether it be my fixation on Medicare Part C or, things we're seeing in hospice care, the home visiting programs. They're obvious. We have enough data. We are seeing indictments. And yet Congress cannot seem to even come up with a piece of legislation where I can get co-sponsors. And heaven knows, even my office has tried to, we've drafted multiple pieces of legislation. They're just complex. And everyone wants a simple, shiny object. And that's why I asked the capitation question, because from a simplicity of alignment of incentives, that in some ways is the universal solution. And then we have to adopt a number of the control mechanisms through sort of our procurement processes. So with that, I'm going to call the hearing to an end. Thank you for your participation. Thank you for your time. And do be prepared for written questions. And with that, we're adjourned.